I am Haja Wurie. I work for the College of Medicine and Allied Health Sciences, University of Sierra Leone, and I am a multidisciplinary health researcher, mostly focusing on health research, health system strengthening research, and in addition, I'm also engaged in a number of capacity building projects, capacity in the sense of institutional research capacity building and individual research capacity building. I work on the Rebuild project, which is a health system strengthening project generating evidence to inform policy making in fragile and conflict affected states. And one of the projects that I'm working on now is the Close to Community Care Provider project, which is basically community health workers. So these are health workers who are embedded within the communities, and they're usually classified as the eyes and ears of the health system at the community level. And in the context of Sierra Leone, it's important that we understand the benefit of using community health workers, because as you may be aware, Sierra Leone is a post-conflict country, and recently we went through an Ebola disease outbreak, and collectively what these two events have resulted in is a level of mistrust, and it created a gap between the communities and the health system itself. And community health workers play a very important role in bridging that gap, ensuring that there is a link between the communities and the health system. And they're very, very important if you think about places where in Sierra Leone, where you have rural areas which are usually hard to reach, and the need for health services is usually greater there. But if you look at the human resource for health capacity that we have in those settings, they're usually quite limited. And having community health workers in those settings help bridge this gap that I mentioned earlier between the health system and the community. So what we're trying to do is to understand how we can better support community health workers. Following on from that, a new community health worker policy was developed, and that's currently being implemented. And what we're hoping to achieve within this project that I'm working on is to support that policy, the implementation of that policy, trying to understand how community health workers can be supported. How can they be, what are the challenges that they face? How can they be managed effectively? How well are they integrated into the health system? And collectively, how does that support sustainability of the program itself? Because if you think about it, money has been spent, it's an investment, so we're trying to see how we can help support and protect that investment. So why is this important in the context of Sierra Leone? As I mentioned earlier, it's a fragile, conflict-affected state, and there's a level of mistrust because of the conflict and the Ebola between the health system and the community, and community health workers bridge that gap. And it's important to everyone really at every level, if you think about it, at the community level, so the communities can understand the role that community health workers play. The stakeholders within that level can also understand the benefits of having the community health workers, so they can be supported in that regard. And at the national level, we can also talk about how we can support the policy itself, because evidence should be used to inform policies. And what this research is doing is ensuring that the voices of community health workers can be captured within the policy. Subsequent reviewing of the policy, the voices of community health workers can be captured in that process. We've used a mixed methods approach to collect the evidence needed to support what we're trying to achieve. And it's been mostly qualitative research, and we've designed it in such a way that we talk to people at different levels. So at the community level, we talk to the CHWs, We also talk to their managers and members of the community that are directly involved in managing CHWs. And also we took it a step further and spoke to a number of people at the national level. So with regards to the community health workers, we used life history approach, where we just try to find out from the CHWs what motivated them to become CHWs and what their life journey has been like. And we also use community mapping exercise, wherein they were asked to map out their communities and then talk about the different challenges that they face, the opportunities, the successes in what they do in their day-to-day activities. And to complement that, we also use the photo voice method, wherein we would ask them to take pictures of their communities and of things that impact their work as community health workers at the community level. So it could be something positive, it could be something negative, and it could be something that they have done, that they have advocated for, that has created something positive within their communities. With regards to the managers, so we spoke to different levels of managers of CHWs to understand how they could be better managed and supervised, what are the current structures that they have in place. So we spoke to peer supervisors of CHWs. So these are CHWs who have been given additional training to enable them to be able to manage CHWs, to supervise, CHWs. We also spoke to the health representative within the Village Development Committee. That's at the community level. And then we also spoke to the focal persons at the district level. So collectively, these are structures that have been put in place to support and manage CHWs. And at the national level, we spoke to key informants within the Ministry of Health. So CHWs fall under the Primary Healthcare Directorate within the Ministry of Health, and they also have a separate hub called the CHW Hub, and they are tasked with dealing with anything pertaining to CHWs. So we conducted key informant interviews as well with representatives from both the Primary Healthcare Directorate and the CHW Hub to understand better at the national level what the policy is saying about CHWs, how they're supported, how they're managed, are there any challenges faced so far in implementing the policy, what are their recommendations from their point of view. And collectively, these findings will give us a holistic understanding of what are the challenges that CHWs face, how we can better support them in terms of management and supervision, and how they can contribute, how they're integrated or not integrated into the health sector. What are the lessons we can learn from implementation so far, and how they can be sustained. One of the key findings coming out of preliminary analysis of the data is that community health workers understand the dynamics of their communities. They're strategically placed to bridge this level of mistrust between communities and the health system, which is very important in fragile and conflict-affected states, and even more important in how to reach rural areas where the need for access to health services is greater. And because they have this understanding of their communities, they have very useful insights into how they can address social determinants of health, harmful gender norms. What I mean by that is the new policy had intended to recruit a lot more women CHWs compared to men because of socio-cultural factors, wherein at the community level, gender norms in most cases, particularly in hard-to-reach areas, a woman's accessing health is not entirely her decision. A pregnant woman accessing health is not entirely her decision. In most cases, the decision is made by the husband or the partner. So if CHWs understand these gender norms, they can address because they have insights into their communities, they can help address these gender norms and also other harmful norms within the community, and they can bring about change from within, and that can help support a bottom-up approach in trying to achieve universal health coverage.